So, what is the Eastern Region Alliance? So, the ERA, as we call ourselves, was formed in 2019, and it is a collaboration between the four SB 40 boards: the city, St. Louis County, St. Charles County, and Jefferson County. So, we had been collaborating off and on for years. But really also operating very independently. And we realized that we were funding many of the same agencies and the same services, but we were requiring different information from our agencies at different times in different formats. And so we decided to align our processes, tools, and technology for our funded agencies. And we believed that if we worked together and we focused our efforts on the right things, we could create many efficiencies and increase capacity for ourselves and the organizations that we fund. So our goal was really, as you see on this slide, to streamline processes and improve outcomes for people with developmental disabilities through shared standards, funding applications, and reporting systems. So the Eastern Region Alliance is not a merger. It's really an agreement between us that as much as possible, we will align our funding practices, expectations for quality and accountability, our service guidelines, and invoicing processes while still respecting the unique challenges, differences of each county.
So let's talk a little bit about the ERA's impact last year. So $58 million was approved for services throughout our four counties. That includes not only property tax revenue, but other sources of revenue that each of us may have, which includes things like interest income and grants that we apply for. And then in St. Louis County specifically, we receive transportation sales tax revenue. So all in, it's 58 million, which is a very big number, and we're very, very thankful for that. But as we all know, there are just never enough resources, funding to serve all the services that folks need. But let's talk about the people. It's really about the people. We talk a lot about money in our work, but it is definitely about the individuals that are getting served. And throughout the four counties, over 9,000 individuals and their families were supported last year. If you think more broadly about the services that we fund, you could easily expand that. However, when you think about someone getting employment services, then the funding also positively impacts that employer, their colleagues. If it's a service that we fund helping someone engage in their community, then their friends benefit from those services, et cetera. So while the actual number of individuals themselves is around 9,000, we know the impact is actually much, much beyond that. And we fund over 260 different services throughout the four counties, and 74 partner agencies provide those services, most of whom we have long-term relationships with, such as with the St. Louis Arc. And while we are funders, we truly do consider these agencies that we work with on an ongoing basis our partners, because without them, the services just wouldn't exist. And so we're very appreciative of them. In addition to these metrics, we also capture outcomes and indicators at an individual level. And we also capture success stories, because who doesn't love success stories? And we love to include those in our materials and share those with our boards and in our communities. If you would like to see more information about those kinds of impacts, then you can look at our annual reports, which are located on our website. And speaking of services, they fall into three primary categories. Independent living services help develop skills needed to live in the community. And those services, as you can see here, include pre-ISLA. ISLA is independent supported living assistance. So when we talk about pre-ISLA, those services help people prepare to live on their own in their own apartment or home. And Independent Living Assistance Fund reimburses people for some of the expenses that we know we incur when we move into our own homes. So we all need that new mattress and the new TV, et cetera. So ILAF reimburses folks for those needs. And then supportive housing for people with longer term housing support needs. The second category is community connection, and those services support people in participating fully in their communities in whatever way they choose. So these services include things like community integration. So that's, as you can see here, the camp and socialization services. We have professional services such as counseling, and support systems, which support the entire family through services such as parent training or childcare. And then we also have community transportation, which, you know, transportation is such a huge barrier. We all know that. Anybody who is trying to access services, that's a hurdle. And so we try to do what we can to ensure there is transportation to the services in this particular category. Employment is the last category we're going to talk about today that we all fund. And this includes services that prepare people for work. So whether that's paid work or volunteer work, we have quite a few employment training services. So we help them prepare for work. These services also help them find the job of their choice and achieve really whatever their employment dreams are, whatever goals they set for themselves. And then we also have funding to support services that ensure people can get to and from their jobs. So we have employment transportation as well. So those are the primary services. And these can also be located on our websites if you have further information or if you have further questions.
Because we receive taxpayer dollars, we are very committed to quality and accountability. We have implemented several tools and processes to help us ensure quality and to demonstrate accountability to our taxpayers. So one of those tools is a partner review process. As Shailene mentioned before, when an agency was getting funding from multiple county boards, they would receive usually an annual visit from each board to kind of audit how they were doing things or take a look at how they were conducting business. Well, one of the things that we realized is that that could be done jointly. So the nice thing is we have reduced the number of audits or monitoring visits that agencies receive if they're funded by more than one board. And we really changed kind of the tone of those meetings to be more of a partner review process where we talk about how are things going, what are your current challenges and struggles to deliver services, what are your successes, etc. And so we have partner review meetings for each agency every other year. So they are now on not an annual cycle, but an every other year cycle. Another way that we ensure quality is to basically go to the services, go watch a service being provided, whether it's in the community or at a facility, and really get a feel for what does that service look like. Are the participants enjoying it? Are they having a good time? Do they seem like they like the service? And so we do try to go out and again observe as many different services as we can. We have some requirements for end of the year reporting. So all of us operate on what's called a fiscal year, which runs from July 1st through June 30th of each year. So for example, right now we're in fiscal year 25. And so in July of each year, the agencies all report some information to us, usually in the form of what we call outputs, which might tell us how many people did you serve, how many units of service did you provide, also in the form of outcomes, which might be did families report that they had less stress as a result of this activity or this service? Did people find work as a result of this service? Were people able to move out on their own as a result of this service or stay in their own home? And so those are called outputs and outcomes and indicators. And so we also gather some information at the end of the year, like how close did the agency come to meeting their targets? So agencies typically ask for a certain amount of funding based on how many people they think they can serve in a certain program throughout the year. And so we again look at that utilization of the services. Did the need for the service actually match what they thought it was going to be? If they had difficulty finding participants for the service, why was that? And maybe what were some of the things that they did to market their program? And so that end of the year reporting is just a really good way for us to take a look at the services and what the needs are for the service, what the results are of the service, and again, be able to report that back to stakeholders through activities such as our annual board meetings, our monthly board meetings, or annual reports where we, really report that information back out to the public. And then the last piece, of course, as I think Becky mentioned, or Shailene mentioned, we are talking a lot about money, but again, these are taxpayer dollars. So it is really important that we really focus on the dollars that are entrusted to us. And so we do also conduct fiscal monitoring, which means that we all have a team of financial experts who will go out and look at different agencies' financial reports related to the funding that we give them, and just ensure that the money is being spent well and that things are following general accounting principles, and that the money is again being used for the purpose that it was given. Some people ask us, how do we decide what to fund? There are a lot of different factors that we look at when deciding what to fund. We try our best to assess community needs. That can be done in a variety of ways. Some of us might have focus groups where we ask people to give us feedback about what their needs are. All of us do some level of satisfaction surveys and questions about what needs do people have that aren't being met. We also look at regional trends. So one of the reasons that we also decided to form the Eastern Region Alliance is so that maybe a service that's being provided in one county but not another might want to start in new counties because it's proven to be really successful in the county that it's operating. So it really provides that opportunity for expanding services into other areas. We also, of course, look at statewide and national trends. We're all 4 members of a statewide association known as the Missouri Association for County Developmental Disability Services. It's a really long name. We call it MACDDS. And so that's an opportunity for us to talk with the other Senate Bill 40 boards around the state, and we learn from each other. We learn about successes and challenges and new innovative ideas and ways to create new programs and services for people, and to, again, demonstrate that meaningfulness of the different services that we fund. We look at best practices. We want to look at what is the research telling us are some of the best of the best programs, services, practices that are out there. And we really want to be offering the residents in our counties the very best services that they can be receiving. And then we look at what other funding might be available for some of the services. As many of you probably know, the Department of Mental Health funds quite a few services for people with intellectual and developmental disabilities. Vocational rehabilitation really focuses on a lot of employment funding, and Medicaid is a very large payer of services for people with developmental disabilities. We typically think of Medicaid as just a health insurance program, but it really goes beyond that and funds a lot of ongoing community-based services for individuals. And so then we try to use our tax dollars to help fill the funding gaps. Where are those gaps in services that maybe we can help to fund that other payers don't pay for? And how do we also help those that don't qualify for Medicaid? Because Medicaid does pay for so much that some folks feel left out because they don't have access to Medicaid for a variety of reasons. So we really try to look at all of those factors when we are deciding what to fund each year. So how do you get connected to our services? As several people have mentioned already, we all have websites. There's quite a bit of information there, but I think you'll find them all really great, informative websites, lots of resources, and again, just how to contact each of us. We also together have an IDD Gateway Resource Guide, and that's again just a really great single source of resources that can be used by providers, by individuals with disabilities, by families, to really again learn about all the services in one single location. For all of us, we typically use the Department of Mental Health Regional Office to determine a person's eligibility for services. There has to be documentation that someone does have a developmental disability according to state law. And so one way to do that is to contact the local regional office in St. Louis and ask to go through the intake process to determine eligibility. Now, two of the boards, which are the DDR in the city and the PLB in the county, they can also determine eligibility based upon records that you might be able to provide to them. So there is that opportunity with two of the boards. Or you can contact a service provider directly, like Sharon, for example, or any of the other people at the St. Louis Arc or Easter Seals or United Cerebral Palsy or a host of other agencies. You can contact that service provider to basically find out what is the process to get connected to services.
All right, so Stacy just mentioned eligibility, so we might be wondering, what does that look like? When you go to the regional office, this is some of the criteria they will use to help determine eligibility. Basically, it is a qualifying diagnosis, some of which are on the slide here, that is diagnosed before the age of 22. Eligibility also looks at substantial functional limitations that are likely to continue indefinitely in some of the areas that you see on the slide, such as self-care, understanding and communicating language, self-direction, mobility, excuse me, and those kind of areas. Some of you may know us as your case management provider. And while having case management is not required to receive our funded services, some of the ERA boards do provide targeted case management in addition to the funding that we do. Case management providers work with individuals and support systems to create an individualized plan and promote the power of choice regarding services that best meet the individual's needs or goals. You can see on the screen the options in the 4 different areas. The regional office provides case management in all the areas, and then there's also an alternative in each area, 3 of which are our county boards. Case managers can also connect people with the services that the ERA funds, but you also, like we mentioned earlier, you don't have to have a case manager to get our services. So how can you help? Our goal, the ERA's goal, is to support as many people with IDD as possible. And the most effective way that we've found to reach people in need is through word of mouth. So we would just ask that you share what you've learned about available funding and hopefully what you now understand is the good work that we do on behalf of our taxpayers in our areas. To help other people become aware of when they pay that line on their tax bill, it's going for some really, really good use, and we take it very seriously and just try to steward those dollars as best as possible. And then we also just thank you for allowing us to speak at things like this to help educate just who we are and what we do.